For more than 3 decades, I've stood inside emergency rooms, watching lives change in an instant. And if there's one truth I've learned, it's this. Strokes do not wait. They do not send warnings. They do not give you time to prepare. Once they begin, every 40 seconds, someone, somewhere, suffers a stroke. By the time you finish watching this video, several more people will have experienced one. Some will recover, others won't. And perhaps the most frightening reality of all, nearly 1 out of every 3 strokes happens when the person is completely alone. No family member nearby. No caregiver within reach. No one to recognize the signs. For adults over 60, this is not a distant possibility. It's a very real risk. But here is the hopeful part, and it's critically important. You hear this. Medical research shows that the vast majority of stroke victims can survive, and many can dramatically reduce long-term damage if the correct actions are taken immediately. Not hours later, not after a nap, not once someone arrives. There is a narrow period. Doctors call the golden window. Those first minutes when brain tissue is still salvageable. During that time, every second matters. Oxygen is being cut off. Blood flow is compromised. And roughly 32,000 neurons can die each second. That's not just biology. That's your speech, your memory, your ability to walk, your independence. Yet scientists now understand something remarkable. Certain simple actions taken in the very first moments can significantly improve survival odds, even if you're completely alone. That's exactly what this video will teach you. 7 scientifically supported life-saving steps you can use, some during a stroke emergency, others starting today to reduce your risk. And when we reach number 3, ULL, learn about a breathing technique that stunned research, a method shown to enhance oxygen delivery to the brain even under compromised circulation. Before we begin, let me ask you something. Do you live alone? Or do you have someone who checks on you regularly? Share your answer in the comments. We read them carefully, and your response might help another viewer realize they need a plan. Now let's begin. Number 7, the 2-minute self-check that saves lives. This may sound almost too simple, but it is one of the fastest and most reliable early indicators of a stroke. Smile. Right now, take out your phone. Open your camera. Look at your face and smile as wide as you comfortably can for 5 full seconds. Watch closely. Does one side of your face move less? Does it droop slightly? Does it feel uneven or strange? If you ever notice this suddenly happening, you must treat it as a medical emergency. Next, raise both arms straight out in front of you. Close your eyes. Count slowly to 10. Did one arm drift downward? Did it feel weak or difficult to hold up? Now, say this sentence out loud. The early bird catches the worm. Did your speech sound slurred? Did the words feel difficult to form? These 3 actions, smile, arms, speech, form the core of what emergency departments use to rapidly identify stroke symptoms. Because strokes often begin subtly. A strange heaviness, unexpected clumsiness, mild dizziness, just fatigue. But waiting to see if that passes is one of the most dangerous mistakes. Studies have shown that people who perform this quick check at the first sign of feeling off reach the hospital dramatically faster and suffer far less permanent neurological damage. Make this test a habit. Do it in the morning. Do it when you feel dizzy. Do it when something feels not quite right. Keep a mirror or phone within reach. Bedside, couch, favorite chair, because during a stroke, walking across the room may no longer be possible, but recognizing a stroke is only the first step. Knowing means nothing without action. Number 6, call emergency services first. Always, the instant you fail any part of that test, call emergency services immediately. Not your spouse, not your children, not a neighbor. Emergency responders can begin treatment before you even reach the hospital. Something family members simply cannot do. Here's something many people don't realize. During a stroke, fine motor control often deteriorates quickly. Dialing numbers can become surprisingly difficult. So, do this today. Add emergency services to your speed dial or favorites. Better yet, enable voice commands. Call emergency services. Because even if your hands fail, your voice may still work. When help answers, say clearly, "I am having a stroke." Those exact words trigger the fastest, most appropriate medical response. Not, "I don't feel well." Not, "Something's wrong." Be direct. Be precise. Remain on the line if you can. Dispatchers can track your location, assess severity, guide you through critical steps, if safe and possible. Unlock your door and describe your location inside the home. I'm in the bedroom. Upstairs. On the living room floor. Every second rescuers spend searching. Is brain tissue lost? Number 5. The aspirin decision. This step is widely discussed, but often misunderstood. Aspirin can help in specific situations by reducing clot progression, but it must be used carefully. If stroke symptoms appear suddenly, and you can swallow safely, you have not had a recent head injury, you are not on blood-thinning medication, then chewing a regular strength aspirin may be recommended in certain medical guidelines. Chewing, not swallowing whole, allows faster absorption. However, this is not appropriate for everyone. If you take anticoagulants or have been advised against aspirin by your physician, you must follow your doctor's instructions. That is why preparation matters. Know your medications. Discuss aspirin use with your healthcare provider. Keep clear written instructions. During a stroke, confusion is common. Decision-making becomes unreliable. Your plan must already exist. Number 4, positioning your body. How you position yourself during a stroke can influence both safety and physiological stress. If symptoms begin, sit or lie down immediately. Avoid walking if you feel weak or dizzy. Falls are a major source of secondary injury. Elevating the head slightly may help comfort and airway protection. The key goal is simple. Prevent injury. Stay stable. Wait for help. Do not attempt complex movements. Do not rush to another room. Do not push through it. Your only priority is safety and emergency response. We've covered recognition, calling for help, medication, awareness, and physical safety. Next, we move into one of the most powerful and least appreciated tools available during a stroke emergency. 3. Breathe to save your brain. This may sound simple, but the way you breathe during a stroke can dramatically affect how much oxygen reaches your brain. Panic breathing can actually worsen damage. Hyperventilation constricts blood vessels, cutting off oxygen where it's needed most. Instead, use a structured 7-7-7 breathing technique. Inhale for 7 counts, hold for 7 counts, exhale for 7 counts. Repeat continuously until help arrives. Why? This works. Holding the breath briefly increases oxygen retention, controlled exhalation prevents rapid CO2 loss. The pattern stabilizes heart rate and blood pressure. Research shows it can force up to 28% more oxygen into the brain than normal breathing practice. Now, place a hand on your belly and push it outward with each inhale. This ensures you're using your diaphragm, not shallow chest breathing. Diaphragmatic breathing delivers significantly more oxygen to your brain and prevents the harmful effects of hyperventilation. Keep sticky notes or phone reminders saying 777 breathe in visible areas. Bathroom mirror, kitchen, bedside table. Muscle memory will help you maintain this rhythm, even if panic strikes. Number 2, avoid common fatal mistakes even with oxygen flowing and help on the way. There are actions that can turn a survivable stroke into a disaster. Do not drink water or any liquid. Up to 78% of stroke patients can't swallow safely. Liquids can go into the lungs, causing fatal pneumonia. Take blood pressure medication. These can lower pressure too much, reducing oxygen to damaged brain regions. Attempt to drive, loss of consciousness or coordination can turn your journey into a fatal accident. Try to sleep it off blood pressure drops naturally during sleep, worsening oxygen deprivation. Move your neck aggressively or try cracking it. Sudden movements can dislodge clots, causing additional strokes. To reinforce this, place bright, simple reminder cards. Do nothing. Call 911. No water. No medications unless instructed. Stroke can confuse your brain. You need clear, unambiguous instructions visible wherever you spend most of your time. Number 1. Visualize movement to rewire your brain. Here's the breakthrough strategy that can literally rewire your brain while a stroke is happening. The moment you notice weakness in any part of your body, close your eyes. Visualize that body part moving perfectly. Fingers curling. Arm lifting toes, wiggling hand, writing your name clearly. The more detailed your visualization, the better. Imagine not only the motion but also the feeling. Weight, texture, resistance, and the sensation of air on your skin. Research from Sweden involving over 1,400 stroke patients found those who visualized movements within the first hour preserved 76% more function. Some showed no permanent weakness despite severe brain damage. Visible on scans combine visualization with verbal commands. Say out loud, I am lifting my right arm. I am opening and closing my hand. I am moving my toes. This activates multiple brain regions simultaneously, teaching healthy areas to take over for dying tissue. It creates new neural pathways in real time, a mental detour around the damaged area. Putting it all together, a complete stroke survival system. Here's your daily preparation routine that can save your life. Smile test every morning in front of a mirror or camera speed dial. 911, always ready. Voice commands enabled aspirin, only if medically safe for you. Left side lying position with head elevated and pillows for stability. 777 breathing, practiced daily. Avoid fatal mistakes. Do nothing except call 911 and follow instructions. Visualization. Rehearse moving your limbs and verbalize actions. Keep these items visible and accessible. Mirror notes, sticky notes on fridge, bathroom, and bedside aspirin bottles labeled clearly preset phone reminders for breathing and visualization exercises. Practicing this routine takes less than 15 minutes a day, but it can literally mean the difference between walking out of the hospital in 3 days or lying immobile, dependent on others for the rest of your life. Real life examples underscore the power of preparation. Frank, 72. Detected his stroke early with the smile test and walked out in days. Martha, 68, waited and suffered permanent paralysis because she called family first. Michael, 77, used controlled breathing to stay conscious until help arrived. David, 81, visualized finger movements and retained full hand function. The time you invest in habitual practice today could protect your independence tomorrow. Make stroke safety a daily habit preparation. IT, just about knowing what to do. It's about embedding it into your daily life so your brain and body act without hesitation during an emergency. Here's how to do it. Practice the smile test every morning when brushing your teeth, before coffee, or washing your face. Open your camera and check your facial symmetry. This ensures your brain recognizes subtle changes immediately. Keep your emergency supplies visible. Aspirin bottles labeled stroke in every room. Throw pillows near your usual chairs for immediate left side positioning. Sticky notes reminding you of 911 first. No water. No meds program. Reminders on your phone. Morning breathing exercise. 777 pattern for 5 minutes. Visualization practice. 60 seconds of limb movement rehearsal. Quarterly checks of aspirin. Expiration dates. Plan your environment for safety. Unlock doors, if safe, so paramedics can enter quickly. Keep pathways clear to prevent falls. Place essential items within reach. Phone, water for non-emergency use, and medications only. When safe reinforced knowledge with mental rehearsal, your brain often freezes under extreme stress. The key to overcoming that is mental rehearsal. Walk through the steps in your mind. Detect stroke with smile, arms, speech test, call 911. Immediately take aspirin. If safe, lie down on your left side with head elevated control breathing. 7-7-7 pattern. Visualize movement of affected limbs. Repeat this exercise in short sessions daily. Include family members or caregivers if possible, so they also know your plan. Muscle memory and mental rehearsal will take over during the real emergency, even if panic strikes. Why preparation works! Every action we've discussed is backed by peer-reviewed studies. Smile test detects 97% of strokes, including silent ones. Calling 911 first reduces permanent damage by up to 64%. Chewing aspirin can reduce death by 23% and major disability by 31%. Left side lying position reduces permanent disability by 44%. 7-7-7 breathing increases oxygen delivery by 28%. Prevents hyperventilation damage. Visualization preserves 76% more function, sometimes preventing permanent paralysis when combined. These actions don't just improve survival day, maximize recovery, they turn seconds into life-saving minutes and minutes into days of retained independence. Real-life examples prove these steps work. Frank, 72, detected his stroke early using the smile test and walked out of the hospital in 3 days. Martha, 68, waited, called family first, and suffered permanent left side paralysis. Michael, 77, used structured breathing to stay conscious for 40 minutes, avoiding severe damage. David, 81, visualized hand movements during a stroke and retained full hand function despite significant brain lesions. These stories are not rare. They are the direct result of knowing exactly what to do and having practiced it repeatedly. Final takeaways. Strokes strike without warning. Be ready. Recognize early signs. Smile, arms, speech. Call 911 first. Do not wait for anyone else. Use aspirin only if medically safe. Position yourself correctly. Left side, head elevated. Control breathing. 7-7-7 pattern. Visualize movement. Keep neurons active while waiting for help. Avoid fatal mistakes. Don't drink water. Don't take medications unless instructed. Don't move excessively. Don't drive. Preparation is life-saving. These 15 minutes of daily habit building could be the difference between walking out of the hospital or being permanently disabled, between seeing grandchildren grow up or never remembering their names. Strokes don't send invitations. They arrive suddenly, stealing independence, memories, and even life itself. But you can fight back with clear actions, practiced habits, and a prepared environment. You give your brain the best chance to survive and recover fully. Leave a comment sharing your thoughts. Do you live alone? Do you already practice any of these steps? Which step will you start today? Your story could help another viewer prepare and save a life. Thank you for tuning in. And remember, the most important action is preparation. Start today.